Left atrial enlargement or left atrial dilation refers to enlargement of the left atrium of the heart, and is a form of cardiomegaly. Causes: in the general population, obesity appears to be the most important risk factor for LAE. LAE has been found to be correlated to body size, independent of obesity, meaning that LAE is more common in people with a naturally large body size. Also, a study found that LAE can occur as a consequence of atrial fibrillation, although another study found that AF by itself does not cause LAE. The latter study also showed that the persistent type of AF was associated with LAE, but the number of years that a subject had AF was not. Obstructive sleep apnea may be a cause of LAE in some cases. When an OSA event occurs, there is an attempt to breathe with an obstructed airway and the pressure inside the chest is suddenly lowered. The negative intrathoracic pressure may cause the left atrium to expand and stretch its walls during each OSA event. Over time, the repetitive stretching of the left atrium may result in a persistent left atrial enlargement. Clinical implications: although other factors may contribute, left atrium size has been found to be a predictor of mortality due to both cardiovascular issues as well as all-cause mortality. Current research suggests that left atrium size as measured by an echocardiograph may have prognostic implications for preclinical cardiovascular disease. However, studies that have found LAE to be a predictor for mortality recognize the need for more standardized left atrium measurements than those found in an echocardiogram. Diagnosis: LAE is suggested by an electrocardiogram that is a pronounced notch in the P wave. However, if there is atrial fibrillation, a P wave would not be present. In any case, LAE can be diagnosed and measured using an echocardiogram. Characterizing the size of the left atrium according to its volume is preferred over a single linear dimension since enlargement can be different for different directions. For example, because of the smaller distance in the thoracic cavity between the sternum and spine, compared to the other directions, there is less room for enlargement of the left atrium along the anteroposterior axis. By approximating the shape of the left atrium as an ellipsoid, its volume can be calculated from measurements of its dimensions along 3 perpendicular directions. Indexing the left atrial volume to body surface area is recommended by the American Society of Echocardiography and the European Association of Echocardiography. The values for volume BSA in the following table are the ones that are the best validated and are the same for both men and women. References: Stritzk J., Marcus MRP, Dudestat S., Lieb W., Luchner, Dar Paragraph Ring A, Kiel U, Hens H. and Schrankert H. The aging process of the heart. Obesity is the main risk factor for left atrial enlargement during aging, the Monica KORA study. Journal of the American College of Cardiology 54, 1982 Euro 9 doi, 10.1016/J Jack. 2009.07.034. PMID 19909880. Retrieved December 2, 2009. A.B. Patel Dar, Levi C.J., Melania V., Shao S., Gilliand Y. Clinical Implications of Left Atrial Enlargement, a Review. The Oxner Journal 9, 191 Euro 196. PMC 3096293. PMID 21603443. A.B. Sanfilippo A.J., Abascal V.M., Sheehan M., Oertel L.B., Harrigan P., Hughes A. and Wieman A.E. Atrial enlargement is a consequence of atrial fibrillation. A prospective echocardiographic study. Circulation 82, 792 Euro 7 doi, 10.1161/01 CIR. 82.3.792. PMID 2144217. Retrieved December 2, 2009. Ozranek M., Bersi F., Bailey K.R., Grossart Branch, Brown Road J.R., Kopecky S.L., Tsang T.S. and Swart J.B. Left atrial volume predicts cardiovascular events in patients originally diagnosed with lone atrial fibrillation, 3-decade follow-up. European Heart Journal 26, 2556 Euro 61 doi, 10.1093OE483. PMID 16,141,257. Retrieved December 27, 2009. See pages 2560. Left ventricular filling pressure, LAV, and AF. Latina JM, Est3NAM, Garlitsky AC. The relationship between obstructive sleep apnea and atrial fibrillation, a complex interplay. Pulmonary Medicine 2013, 1 Euro 11 doi, 10.1155621736. PMC 3,600,315. PMID 23,533,751. Retrieved August 11, 2014. See Section 5.1. Aithouse J., Thackara K., Callel J. M. ABC of Clinical Electrocardiography. Conditions affecting the left side of the heart. British Medical Journal 324, 1264 Euro 7 doi, 10.1136/BMJ. 324, 7348, 1264. PMC 1,123,219. PMID 12,028,984. Retrieved June 18, 2010. Atrial fibrillation. American Heart Association, Incorporated December 4, 2008. Archived from the original on March 28, 2009. ABC Lang, R.M. Beer M., Devereux R.B., Flatschkampf F.A., Foster E., Peluca P.A., Picard M.H., Roman M.J., Swidge J., Shanewise J., Solomon S., Spencer K.T., St. John Sutton M., Stuart W. Recommendations for chamber quantification. European Journal of Echocardiography 7, 79 Euro 108 doi, 10.1016/J urge. 2005.12.014. PMID 16,458,610. Retrieved August 26, 2012.